This segment is sponsored by ARA Diagnostic Imaging.
Welcome back to We Are Austin. Minimally invasive and highly effective. We're talking about interventional radiology. It's the medical treatment of the future. And I'm joined this morning by Dr. Michael Jaimes from ARA Diagnostic Imaging to tell us how this method can improve and even cure major health issues. Good morning. It's great to see you.
Good to meet you, Trevor, and thank you for having me on the show. Thank you for inviting me.
Yeah, this is a fascinating topic. I had not heard of this. Can you tell us a little bit about interventional radiology and why it's so important?
Great. Well, I'm glad you asked. Not a lot of people know what we do, interventional radiology is a subspecialty of medicine. Specifically, it's a subset of diagnostic radiology. These are highly trained doctors that go to school for 4 years of college, 4 years of medical school, 1 year of general internship, followed by 4 years of general radiology, and finally finish with interventional radiology before they can start practice.
Wow, that's amazing.
Right, so what I love about interventional radiology is we tend to be at the forefront of medicine almost in every procedure and everything we do.
That's fascinating and minimally invasive at that, which is so great.
Yep, well this is a slide here that really shows a lot of text, but that's not important. What it really shows is that we are involved really in all the organ systems of the body. And we do this through minimally invasive procedures. We make very small incisions in the groin. Sometimes those incisions are barely visible. And we navigate very small catheters directly into the organ systems, or they can be small needles, which we then will deliver therapies through.
Oh, wow, that's amazing. And everywhere in the body.
Yep, everywhere in the body. So this is a slide which shows a big name, but I'll explain this in a second. We can talk about liver tumors, right? Yeah. So liver tumors tends to be my sort of subspecialty, and I love treating liver tumors. Yeah. So liver tumors are traditionally treated with oral chemotherapy or IV chemotherapy, sometimes open surgery. Some patients are candidates to be treated by interventional radiologists, and we do this just like we talked about on the last slide. We'll make a very small incision, barely visible. We'll navigate a very small catheter, as this dotted line shows, that will eventually end up in the liver.
Oh, wow.
And then if you go to the next slide, here's a picture of a large tumor that's surrounded by lots of arteries, unfortunately. And over here is our catheter, which is getting very close to the tumor, and those little dots are particles. We can load those particles with radiation, and then when we deliver that radiation to the tumor, that's called radioembolisation with yttrium-90.
Oh, fascinating.
Our goal is to shrink the tumor or eliminate it completely and really try to prevent those therapies.
And you brought an example of that. We have a video to show.
Yes, you can. So as you can see on this video, our catheter is directly inside the liver. We are administering contrast or dye, which is that dark line that you see there on the bottom.
Right.
And unfortunately, what stands out is this big rounded black spot. And that big rounded black spot, that's a tumor.
I see.
And the reason it's so dark is it's soaking up all our dye, which is no different than the tumor soaking up nutrients, electrolytes, oxygen, all of those things. And if you go to the next slide, do you see a difference with this one?
I do. It's not as dark. The color is not as dark.
That's right. So our catheter is in the same spot, but the fact that we're not seeing the tumor is proof positive that we have delivered our therapy directly to the tumor. So it's no longer receiving nutrients, and the nutrients then go to the liver, which is what makes the patient feel better.
That's fascinating. You can see such a difference there. And this can be put to use in other ways.
Right. So this is one of my favorite procedures. It's probably the newest thing on the forefront. This is a picture of a prostate. This is bladder on top, and this little tube here is called the urethra, which helps empty the bladder. Unfortunately, in men, prostates tend to enlarge over time.
Right.
There's not a cancerous growth. It's really just prostate cells that are either dividing or getting larger themselves, and this narrows that little urethra.
Right, exactly.
That will give patients symptoms of increased frequency. It'll give patients a sense of urgency of having to wake up multiple times at night, sometimes bloody urine. In extreme cases, it can be really painful. So we can treat this.
Yeah, and that can impact your quality of life as well.
That's right. So and again, we do similar procedure, very small incision, guide our catheter directly to the prostate. And then this finally shows that we are delivering those particles directly to the prostate. There are those small beads.
Yeah, that's fascinating.
Yep, there are those small beads. After we treat that side, we'll turn our catheters, treat the other side.
I see.
And then we get this result on the next slide, which is Now the prostate's smaller, the urethra is larger, the bladder is able to empty. So
wow.
Revolutionary procedure.
It really
Yep,
is,
it's called prostate artery embolization. We can do this as an outpatient, minimal sedation. Patients have quick recovery time.
Yeah.
And perhaps most importantly, men can preserve their sexual function compared to traditional surgeries.
That is incredible. It really does seem like it's on the forefront of medical procedures and minimally invasive, outpatient, not a lot of downtime.
That's right.
That's incredible. Where can we go to find a little bit more information about interventional radiology?
Sure. Well, you can go to osrad.com, okay, and that's our website where you can learn about all the procedures we do, such as uterine fibroid embolization. We treat blocked arteries. We treat varicose veins. And as you know prostate as well. And if you don't like the website, then of course you can call us directly. It's 512-467-X-ray or 512-467-9729.
Doctor, that is fascinating stuff. Thank you so much for joining us today.
Well, thank you for having me.
Really
it was a
important
pleasure.
work. Absolutely.
Thank you.
Thanks so much for being here.